So we're very fortunate that we've got excellent childhood vaccination now to prevent childhood pneumonia. And we've recently also had new vaccinations against a respiratory syncytial virus, RSV, which is the major cause of childhood pneumonia currently. And what we know from studies that have been running long term is that early life childhood pneumonia has a very important effect on lung health. It impacts by negatively affecting lung health, by reducing lung function, and potentially setting the early roots for development of diseases like chronic obstructive pulmonary disease, like asthma. So that childhood pneumonia early in life, particularly in infancy and particularly severe pneumonia, in which children, for example, are hospitalized, impairs lung function, impairs lung health, and sets that child on a trajectory for impaired health for life. So I'm very excited at this point in time. We actually have the tools to prevent a lot of the burden of severe lower respiratory tract illness. But unfortunately, vaccination is still not optimally done in children around the world, and particularly in some African countries where coverage rates are really suboptimal and are low, and where we see that not a single country in Africa has nationally implemented prevention strategies for early life respiratory syncytial virus. We look globally, many high-income countries have implemented these strategies. Countries like Brazil, like Chile, have national programs for preventing RSV. And we in Africa are lagging behind for the children who need it the most. So I think there are several challenges. Some are programmatic, and the platform for delivering vaccines. These vaccines are either delivered as part of the EPI program in childhood, or some vaccines are delivered as maternal vaccination during pregnancy. And those can be challenging platforms. I think there are also the challenges of lack of information about how effective and safe these vaccines are. I think we're in the era of vaccine hesitancy, a lot of misinformation about the safety, about the effectiveness of these vaccines. But what we do know from accumulating information around the world is that, for example, if you look at these new RSV preventive interventions, they're highly effective, they're safe, and they have a profound impact. So if you look at a country like Chile, their hospitalizations for childhood pneumonia have completely plummeted. Similarly in Spain, complete disappearance of many hospitalizations for childhood pneumonia. Of course, another big challenge is cost, and for governments to find the funding to implement these interventions. Fortunately, Gavi-eligible countries can access Gavi funding for the EPI immunizations, and also will be able to access for the maternal vaccination to prevent RSV. But I would also urge that we need cost-efficacy analyses, because all the analyses we have show that vaccination, and if you look at RSV vaccination, for example, is highly cost-effective and even cost-saving. In Chile, the models show huge cost-saving to the healthcare system because you prevent so many hospitalizations and severe illness.